Hi, I'm Dr. Jason Collier, and welcome once again to another one of our video blogs. And I wanted to take you through another case of a patient that we had the pleasure and honor of treating. And once again, I want to give you a little warning ahead of time that there are some graphic surgical scenes that are to follow. But this is how this patient presented to us. As you can see, there's a number of issues going on, both cosmetic and some number of decayed teeth, some infected things going on. So decayed teeth all around. Just to point out a few of them. We also have just one of the other issues that we were concerned about and wanted to address, and for his final restorations, he had quite a bit of an extreme incisal wear due to an end-to-end occlusion, or all he's hitting on is just his front teeth and is kind of ground them away. Here's a view of his teeth from the side, another shot of teeth from the opposite side. This isn't the greatest photo in the world, but these are the teeth from what we call the occlusal view. These are his upper teeth, and then his lower teeth as well. So we had a number of broken teeth, number of decayed things, number of missing teeth, and we want to address this patient and recommend treatment in a comprehensive manner, both working with what his goals are and what we feel is going to be the best mode of treatment for him. This is just an image of his smile as he presented to our care. As you can see, he had ground those teeth off quite a bit in the front with a very shortened length of those front teeth. One of the things we certainly wanted to address. This is an image of his radiograph. A number of broken off teeth, some root tips that were that were still in place. The recommendation and the treatment that this patient decided to follow through with, as we discussed things together, was we decided to come back and replace all of the missing teeth, remove the bad teeth, replace the missing teeth with implants, individual implants in those cases, and then once everything had healed, we were planning to come back in and do final restorations with porcelain crowns and veneers. So this was the day of surgery where we did place implants. We had to do some grafting in a few places. This is an image of the grafting that we had to do in the what we call the posterior maxilla, or the back of his upper jaw. He had an area where he had inadequate bone for implants, and so what we did was what's called some people call it a sinus lift, some people call it a subantrum augmentation or sinus augmentation. So all we did was created a small little window in the side of the bone here, and there's just a little membrane that's inside there. We just gently lifted that membrane, teased that membrane away from the encasing bone, and we added a bone graft material in there to allow the blood supply to come in and turn that over with new bone. And this was a case where we felt like would be a great place to go ahead and place implants at the time of grafting. And I got to tell you one thing about this patient. This patient was so excited about moving forward with treatment, and he just loved us so much. Even after we discussed the complications with smoking, this patient failed to tell us that he was still smoking, and it was just such a hard thing for him to give up, and he was hoping to have given up the habit, have kicked it before we move forward with treatment. But again, he was so excited, and he loved us so much, he just didn't have the heart to tell us. And so this is an image of the implants in place after we did add the bone graft, which is a very predictable, very very common procedure that we do. We have great results with. But I wanted to show this just to point out that though smoking is not a 100% indication for not moving forward with treatment, but there is an increased risk of non-integration with implants, or in other words, the bone not healing as we want them to around implants. But certainly in areas where we're doing maybe a little bit more grafting, that does tend to have a bit more complications with people who are continually smoking. And so this young man did have some issues. This is again the image of the implants in place, but we did have an issue with those implants in the upper back area not integrating like we wanted them to. Now the graft was not completely unsuccessful. We did gain some bone height, but we did have to remove those implants, and we're actually still in process of working through with him on kicking that habit. It's a hard habit to kick. I understand that, and but we want to get him to a good place before we continue our treatment. So, but this is as the other implants had healed and integrated well, and were looking healthy. We were ready to move forward with the prosthetic phase of treatment for this guy. So, one of the important things in full mouth treatment for our patients is communication with the lab. So first we have to have a great, really in-depth discussion with our patients on what their goals are. We look at samples of teeth and samples of smiles to see exactly what the goals are for our patients, and that gives you as a patient, or gives our patients opportunity to kind of custom design their own smile and pick out what they feel is nice and cosmetic. And then we communicate that back to the lab. We take impressions of our patients' teeth before we even touch them with restorations. So the purpose of this image is for us to give our lab technician that we're working with, and we work with some great lab technicians, some of the best in the country. And so this image is called a stick bite. So we're giving the lab a representation of how his teeth relate to the pupils of his eyes. So we want his occlusal plane, or the plane of his bite, the plane of his front teeth, his smile, to be parallel with the pupils of his eyes, so that we don't have a cant one direction or the other. So this is a great way to do that for our lab. We also took an image of this patient from the side to communicate with the lab just how his profile looks, and how much room there is to extend teeth forward. And as you may be able to see, he is a bit overclosed due to the missing teeth in the back and due to the wear on his front teeth, which was one of the things that we wanted to address. So one of the goals for him was also to open his bite and reestablish that. So as we've discussed in previous blogs, we want to take our patients through a prototype phase, or some people call this the temporary phase. So this patient has prototype crowns, veneers in place, so that he gets to have a visual of what a very close representation of what his final prostheses are going to look like, how they're going to feel in his mouth, how his bite's going to be. We want to make sure that his jaw can handle the movements of how we have the teeth positioned and shaped. He gets to see how the teeth. He gets to see all the little curves and points in the teeth. He gets to see the shade that we have planned for his teeth. And if there's anything that he's unhappy with, that's something that we can fix and adjust, and then just communicate that back with our master lab technicians. And whenever we move forward with the final prostheses, we can have it made exactly to our patient's desires. Here we are after we've moved forward with the final restorations in place. Have nice healthy implants. As you can see in the X-ray, we have the bone has healed very nicely around the implants, despite the smoking. Once again, I do want to point out to all doctors and patients that we strongly recommend that patients stop smoking, but we can get good results on patients who are smokers as well. But it is a known fact that we do have a little bit of an increased risk with those who are smoking. But as you can see here, great result. Bones looking nice. Tissues looking nice around his teeth, around his implants, and this is his smile. So we were able to take this patient once again from this place, number of issues going on, very unaesthetic, to this place here, where he is once again able to eat like he hadn't eaten. I think he was just about as excited about being able to eat like he had a long time before. He was just as excited about that as he was about his smile. But he's at a place where he feels so much more confident about his smile. He's much more comfortable, and he's able to eat like he hasn't in a very long time. So, as you can see, whether you're a doctor or a patient, this is something that we can work alongside you as a doctor in moving patients through this process, and we're happy to do that for you. Or if you have patients, or if you are a patient who feels like you would like to move through the restoration phase with us as well, we're happy to do that also. If you have any questions or comments, please feel free to give me a call. I'm happy to help. If you want to call and schedule a consultation, or call and schedule a consultation for one of your patients, please do so. Thank you so much for watching. This is Dr. Jason Collier with Southern Dental Implant Center. Thank you so much.